Welcome to The Explainer. Today, we're diving deep into a really critical, but honestly often misunderstood part of hormone replacement therapy, or HRT, and that's progestogens. If you've ever felt kind of lost in the weeds with this topic, you're in exactly the right place. So let's get into it. So you probably know that estrogen is the star of the show when it comes to managing menopause symptoms, right? Things like hot flashes, mood swings, the whole deal. But here's the thing. If you have a uterus, taking estrogen all by itself isn't just an incomplete picture. It can actually be risky. There's a vital partner hormone that it needs to work with, and that's exactly what we're going to break down today. Okay, so let's start with the big why. Why is this so important? Well, while estrogen is working its magic, relieving your symptoms, it also has this hidden downside if it's not properly balanced. You can think of estrogen as this amazing, powerful lead singer, but she absolutely needs a steady rhythm section to keep the whole concert from going completely off the rails. And here is the absolute crux of the issue. Estrogen's main job is to build things up. So, when you take it all by itself, what doctors call unopposed, it's constantly sending a signal to the lining of your uterus, the endometrium, telling it to grow and keep on growing. And the longer you take it and the higher the dose, the more it grows. This kind of unchecked growth, well, it can lead to a very specific medical problem. That problem has a name: endometrial hyperplasia. It literally means an abnormal thickening of the uterine lining. And this isn't just some harmless side effect. It's a serious condition that is a major risk factor for developing endometrial cancer. This right here is the fundamental reason why just taking estrogen isn't the full story for most women. So this number might just look like a number, but the story behind it is pretty staggering. This comes from a huge study, the PEPI trial, where almost 12% of women who were taking only estrogen developed this precancerous condition. Now get this, for the women in the same study who took a balancing hormone along with their estrogen, how many developed it? 0. Not one. That is just a powerful, powerful illustration of why this balance is so essential. Okay, so if unopposed estrogen is the problem, then what's the solution? Well, let's introduce the hero of our story. Progestogen. You can think of it as a dedicated, full-time bodyguard for your endometrium. That's its whole job in HRT. To put it simply, progestogen comes in and basically tells estrogen's growth signals to stand down. It flips a switch in the uterine lining, changing it from a growth phase to a stable secretory phase. This stops the lining from thickening and prevents that dangerous buildup of cells. It is the essential check and balance in the entire system. All right. Now, this is an area where a ton of confusion can creep in, so let's clear up the language real quick. Think of progestogen as the big family name. It's the umbrella term for everything. Under that umbrella, you've got progesterone, which is the natural body-identical stuff, the same kind your body makes. And then you have progestins, which are all the synthetic, lab-made versions. Knowing this difference is really key to understanding all your options. So once you know you need a progestogen, the next question is pretty obvious, right? Which one should I take, and how do I take it? And this is so important. It's not a one-size-fits-all deal. It's really all about finding the right fit for your body, your risk factors, and your lifestyle. First up, you've got two main schedules to think about. There's the sequential way, which is cyclical. You take the progestogen for about 2 weeks every month. This kind of mimics a natural menstrual cycle, and it usually results in a predictable monthly bleed. Then there's the continuous option. With this, you take a lower dose every single day. And the goal is to stop bleeds completely. Though, just a heads up, it can take a few months for your body to adjust, so some unscheduled bleeding at first is pretty common. And there are a bunch of different ways to actually get that progestogen. The oral pill is definitely the most common, but you've also got an intrauterine system, or IUS, like the Mirena coil. This is great because it delivers the hormone right where you need it, in the uterus, which means fewer side effects throughout the rest of your body. Then there's a transdermal patch, which is awesome because it bypasses your liver, which can reduce certain risks and side effects. And finally, the vaginal route can be a fantastic option if you're sensitive to the oral pills. Now, you might see it used off-license, but don't let that term scare you. It just means a doctor is prescribing it for a purpose other than its original one, which is an incredibly common and safe practice in medicine. Okay, we have to be really direct about the potential downsides. Let's talk about side effects. For some people, they can be a major reason for stopping HRT. And it is so important to validate this. It's not just in your head. These side effects can be genuinely tough, and finding a way to manage them is a huge part of good medical care. The things we hear about most often are side effects like mood changes, bloating, and just feeling puffy from fluid retention. But, and this is a big but, here is the really good news. Not all progestogens are created equal. Remember that body-identical form we talked about, micronized progesterone? Well, it turns out it's often much, much better tolerated. It tends to have a gentler side effect profile than a lot of the synthetic versions, and that is an absolutely critical piece of the puzzle when you're trying to tailor your treatment. All right, let's get to the big one, the question that's probably on your mind. Is this stuff safe to take in the long run? It is so essential to have a clear, no-nonsense, evidence-based understanding of the risks so you can weigh everything properly for yourself. The whole conversation around HRT and breast cancer can feel really scary and confusing, so let's just make it clear. Taking estrogen all by itself is linked to very little or even no change in your breast cancer risk. It's when you add the progestogen, which we have to do to protect the uterus, that we see a small increase in the absolute risk. And it seems to depend on how long you take it. But to really understand what that small increase means, we need context. And this is the key. A number floating in space without any context is basically just noise. To truly get a handle on this risk, we have to put it side by side with other common, everyday things that also influence breast cancer risk. And this is where that context just becomes crystal clear. So have a look at these numbers. Over a 5-year period, taking combined HRT is associated with about 8 extra cases of breast cancer for every 1,000 women. Now, let's compare that. That is the exact same level of risk as drinking 4 to 6 units of alcohol a day, and it's actually less than the risk associated with being obese compared to being a healthy weight. Now, this doesn't make the risk disappear, but it frames it in a way that we can actually understand and grapple with. And, it's not just about breast cancer. For other risks, how you take your HRT makes a huge difference. Take blood clots, or VTE. Taking pills increases the risk, but the absolute safest option is using estrogen through the skin, as a patch or a gel, combined with oral micronized progesterone. The same thing is true for stroke risk. Transdermal is safest. And for heart disease, we know that starting HRT before you turn 60 is generally protective for your heart. The choices you and your doctor make can actively lower your risk profile. So, after all of that information, what is the single most important thing to take away from all this? It's simple, really. Your HRT journey should be exactly that, yours. It has to be tailored specifically to you. Here's a quick roadmap you can use to have a really informed chat with your doctor. Number 1, confirm the need. If you have a uterus, you need a progestogen, period. 2, think about your own history. Are you sensitive to side effects, especially with mood? 3, evaluate your personal and family risk factors. 4, choose the right route. The delivery method matters. And finally, number 5, tailor the plan. Work with your doctor to find the specific type, dose, and schedule that works perfectly for you. And honestly, if you only remember one thing from this whole explainer, let it be this quote. The route and type of progestogen administration should be tailored to the patient's risk factors and preferences and balanced with the potential side effects. It's all about a partnership between you and your doctor to find that perfect balance. This field is changing all the time. Research is constantly giving us new insights. And that leaves us with a really fascinating question for the future, doesn't it? As we learn even more about the tiny differences between all these hormones, how much more precise and personalized can this treatment get? It's a really exciting time for women's health. Thanks so much for watching.